I'm Samantha Reilicke, and this is the case for physician-assisted suicide. Earlier this month, Robert had to put down beloved dog Paddington. Below, Robert details Paddington's last month spent suffering. Paddington was riddled with tumors. He was prone to persistent vomiting that often came at such great force that he would actually bash his head on the ground. And lastly, he was starving himself to prevent the vomiting spells. Robert tried medication to no avail, and ultimately decided to put Paddington down and release him from his suffering. Similarly, this is 59-year-old Michael Askim and his wife Nikki. In 2018, Michael was diagnosed with bulbar motor neuron disease. A once lively individual, Michael now amounted to nothing but a shell of a human. His condition deteriorated rapidly, and since last August, he hasn't even been able to consume pureed foods and had to have a tube inserted into his stomach. Michael now faces choking on his own saliva as he loses the ability to swallow. Unable to walk or talk to his children, Michael Askim has decided to starve himself to death, while dying is still his choice to make. With 29 years of experience in the healthcare industry and a lifetime shared with Michael, Nikki assures Michael is of sound mind, body, and soul, being neither depressed nor having an impaired judgment. And just as Robert concluded with Paddington, Nikki explains, "We have a dog, and none of us would allow our Barney to suffer the way Michael is. We would be considered cruel to keep him alive. He wants to die with dignity." If the law was changed, it would allow either Michael's family or clinician to administer medication that would allow him to die peacefully without suffering. However, critics argue that by offering physician-assisted suicide, it is encouraging patients to choose death over hefty medical bills and the burden of loved ones, particularly when the choice is posed to an especially vulnerable population, that being the elderly and/or the disabled. Additionally, Helena Berger, the president and CEO of the American Association of People with Disabilities, explains that insurers are likely to support cheaper options. Let's look at the current US figures. Currently, 72% of Americans surveyed agree that doctors should be able to help terminally ill patients die. Also, it's important to note that when the prompt includes the word suicide, there is a significantly smaller support. Also, some form of physician-assisted suicide is legal in 9 states and Washington, D.C. Lastly, there is a statistically significant correlation between religion and support, which can be seen to the bottom right. It's no secret that losing someone is hard, but keeping loved ones alive artificially is more for those left behind than the individual themselves. Which begs the question, do we keep loved ones alive and in misery for ourselves or for them? The Cost of Dying, a story on 60 Minutes, revealed that Medicare paid $55 billion to doctor and hospice bills during the last 2 months of patients' lives, and around 30% of these expenses had no meaningful impact. And Medicare cannot reject treatment based on cost. However, statistical evidence that financial pressures guide patients toward physician-assisted suicide do not exist. According to Levin Pampantino, an expert at the Kennedy Center for Justice and Human Rights, although it is almost unfathomable to even consider the cost savings of assisted suicide, the difference that assisted suicide makes is monetarily insignificant, totaling approximately $10,000. Additionally, the amount of people that would actually qualify for physician-assisted suicide make up less than 1/3 of 1% of Americans each year. And those who do qualify and who choose to die by assisted suicide generally end their lives approximately 3 weeks before their natural deaths would have occurred. Additionally, this myth is further dispelled by the fact that 92% of people in Oregon who chose medical aid in dying are enrolled in hospice care and not receiving expensive or intensive treatment, demonstrating that there would not be a significant amount of money saved if they had chosen physician-assisted suicide. This concludes that there is no financial incentive for physician-assisted suicide. Further, physician-assisted suicide is the last option rather than the easy option. As seen in the figure at the top right, there are already countries that it is legal to perform physician-assisted suicide. The Netherlands conducted a study that revealed that most doctors would not grant psychiatric patients access to physician-assisted suicide, insisting that there are checks and legislation in place to make it a last option as opposed to an easy option. It is also important to note that it is most conceivable for patients suffering from dementia out of all the psychiatric patients. Lastly, rights should belong to the individual, not the government. This is largely to do with the issue of life ownership orientation. In a study that examines this, it is stated that by far the weakest belief was that life belongs to the state, and the strongest belief was that life belongs to the individual. Those that believed that life belonged to the individual were more approving of doctor-assisted suicide. To conclude, the right to life or death is a matter of individual conscience rather than a decision for the government to make. The United States should implement physician-assisted suicide for terminally ill patients. Thank you.